Hello guys, as a continuation to our previous topic about the overview of the posterior abdominal wall, right? Today we'll learn about the muscles of the posterior abdominal wall. So this is a small topic. I have divided the topic into pieces because of the to ease the coming lessons, right? Today we'll learn only about the muscles of the posterior abdominal wall, right? There are only three muscles. Okay, actually there are four, but in the four muscles are only in the half of the population, only present only in the half of the population, because there is a muscle called psoas minor, right? It, it presents in only 50% of the population, right? So we learn about the psoas minor also this lesson. Okay, usually there are three muscles, right? Psoas major, iliacus muscle, and quadratus lumbar. These are the main posterior abdominal wall muscles. Okay, sometimes the quadratus lumborum may come under the muscles of the back, whereas the psoas major and iliacus may come under the muscles of the lower limb, which flexes the lower limb. Right? You have already learned about that, the flexors of the lower limb, right? But in general, these are the muscles which give the shape, right? Which give the support to the posterior abdominal wall. Okay, they form a wall against which there lies the vasculature, neurovasculature, and also the viscera of the posterior abdominal wall. Right, on each side of the vertebral column form most of the posterior abdominal wall. Right, coming to the psoas major. Psoas major is a long fusiform muscle. Right, long fusiform muscle extending from the sides of the lumbar vertebrae to the lesser trochanter of the femur. Okay, you'll see that. So this is the psoas major muscle, right? It's a long fusiform muscle. See that selected muscle is the psoas major muscle. Okay, from lumbar vertebrae to lesser trochanter, right? Okay, this is the insertional point, right? This is the lesser trochanter of the femur, right? So it is coming all the way from abdomen to the pelvis to the lower limb, right? This is and it is enclosed in a fascial sheath called psoas. Okay, this is nothing but the psoas fascia. Okay, it encloses the psoas muscle as a psoas sheath, and this is very important sheath in the entire body because of the clinical application. Right? The muscle arises from the 14 fleshy slips that are as follows. The 5 slips from intervertebral discs between T12 to L5 vertebra and adjoining margins of the bodies of these vertebrae. Right? We'll see that. Okay. You see, this is the psoas major muscle, right? And if you see, okay, this is T12, right? That is the T12, and this is L1, L2, L3, L4, L5. So this muscle arises from the vertebral bodies of L1, T12 to L5, and intervertebral discs of T12 to L5, and also the transverse process of the, you see, this is called as transverse process. Okay, transverse process of the lumbar vertebra. If you see, I'll show you. You see, this is the attachments. Okay, origin. You see, there are many original points. You see from the transverse process, right? Intervertebral disc and vertebral body. Okay, to the where it goes to the. You see, this is the insertion. Blue point is the insertion, right? Same. So that is lesser trochanter. So you have to remember this. Okay, 14 fleshy slip, 5 slips from intervertebral disc of T12 to L5, and 5 slips from anterior surface and lower borders of the transverse process of the thigh lumbar vertebra. We have already seen that. You'll see that again. 4 slips. Okay. So this is 5, this is 4. So 5 plus 5 plus 4 is equal to 14. Right. From the tendinous arches bridging the constricted sides of the bodies of the lumbar vertebra. The lumbar vessels pass deep to these arches. So this is the that point, right? Original. See, this is how it originated, right? The previous sections and the especially in the lower limb, we learned that this is appearing like a pillar, right? Almost like a pillar. See, same diagram we have already seen in the cartoon. From the site of the origin, the muscles descend along the pelvic rim and enter the thigh behind the inguinal ligament, right? We have seen that. You see, it's coming and see, this is the inguinal ligament, right? So it is passing behind the inguinal ligament, okay? Passing deep to the inguinal ligament to reach the lesser trochanter, right? Below the ligament, the tendon forms on the lateral side of the muscle, passes in front of hip joint and enters anterior surface of the tip of the lesser trochanter of the femur, okay? A synovial bursa, which may communicate with the cavity of the hip joint, may commonly separate this tendon from the joint capsule, right? So this is the insertion of the psoas major muscle. Usually what happens is psoas major is accompanied by the iliacus muscle, right, at the insertional point, though they may not insert at the exact locality, okay, 1.5 centimeters or 1.2 centimeters away from one another, but usually they pass like as if they are one muscle. That is why they are called as iliopsoas, right? Coming to the relations. The psoas major is the key muscle of the posterior abdominal wall because its relation provide a fair idea about the layout of the structures in the region. Lumbar plexus forms within the substance of the psoas. Okay, you have to remember this. Lumbar plexus. Okay, let us see. You see, these are the ones. Okay, in order to see the lumbar plexus, you have to teach the psoas muscle, right? This is the psoas major muscle, right? The plexus are emanating, coming from the psoas major. They are piercing, right? This is very clear. Okay, this is very clear. You see, so piercing the psoas muscle, right? The plexus can be displayed only by tearing the muscle, right? But it does not divide the muscle into play. Fine nerves emerge from underneath the lateral border of the psoas major from above downward. These are as follows: subcostal nerve, iliohypogastric, ilioinguinal nerve, lateral cutaneous nerve of the thigh, and femoral nerve. You'll see that. Okay. Okay. Let's see like this. This is the iliohypogastric nerve, right? And the select like this, right? The first one is iliohypogastric nerve. Okay, you can see there. This is ilioinguinal nerve. This is femoral cutaneous nerve of the thigh. Okay, and this one is femoral nerve, right? And this one is genitofemoral, right? The upper four nerves emerge above the iliacus and runs downwards and laterally across the quadratus lumborum. The last nerve, femoral nerve, emerges below the iliacus and runs in the groove between psoas major and iliacus muscle. One nerve, genitofemoral nerve, runs downward on front of the psoas major and sometimes while mistaken for the tendon of psoas minor muscle. You see, you can clearly see here. This is femoral nerve. Okay, this is femoral nerve. Femoral nerve is in between psoas major and iliacus. Okay, iliacus occupies the iliac region of the hip bone. This is psoas major, right? So the femoral nerve is not piercing. You see, the femoral nerve. This is the femoral, right? It is not at all piercing the psoas major muscle. It is passing between the psoas major and iliacus muscle, right? Whereas this is the genitofemoral nerve, right? Genitofemoral nerve is emerging in front of the psoas major muscle. Okay, that is about psoas major muscle. And the three important structures lying on the medial side of the psoas major. From medial to lateral side, these are lumbosacral trunk, iliolumbar artery, obturator. You'll see that. You see, if you see the blood supply, this is the psoas major muscle, right? Okay. We'll learn the blood supply of the posterior abdominal wall in the next class, but you have to remember that this is iliolumbar artery. Okay. Okay. See, on the lateral side, right? Iliolumbar artery. You see, iliolumbar artery is like that. Okay, that is iliolumbar artery. Same structures. Coming to the psoas sheath. The psoas major muscle is enclosed in a fascial sheath called psoas sheath found by psoas fascia. Right? Attachments of fascia are as follows. Above, it is thickened to form the medial arcuate ligament, which extends from the body of the L1 vertebra to the tip of its transverse process. Right? That is called as medial arcuate ligament, thickened fascia. Right? Laterally, it blends with the anterior layer of the thoracolumbar fascia. Right? Remember that. And medially, it is attached to the bodies and intervening intervertebral discs of lumbar vertebrae and presents four tendinous arteries. So, above, it is thickened and formed a medial arcuate ligament. Right? Laterally, it is continuous with the thoracolumbar fascia, and medially, it is attached to the bodies of the and intervertebral discs of the lumbar vertebrae. This is very, 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 very important because this is so much of important. Okay, we will learn it lately why it is so important. But remember the origin of the psoas sheath. Okay, below it features with the arcuate line of the pelvis and the fascia covering the iliacus muscle. So it is continuous with the iliacus fascia, right? Coming to the psoas minor, this muscle presents in about only 50% of the population. When present, fixed on downwards in front of the psoas muscle, right? You see, so that is psoas minor muscle. Okay, selected blue structure that is in front of psoas major, right? It is almost continuous with the psoas. Okay, you want to see. Okay, that is the psoas major muscle. Okay, it is a thread-like muscle, that is it is compared with the plantaris muscle. It resembles the plantaris muscle of the leg and is confined to the abdomen. It arises from the side of the intervertebral disc between T12 and L1 vertebra and adjoining parts of the body. From the site of origin, the muscle runs in front of the major and ends in long flat tendon, which is inserted into the iliopubic eminence. Right? It is a weak flexor of the trunk. You will see that if you select this structure. You see that is the origin, okay? And insertion is here, iliopubic eminence. Okay? See, that is the origin and insertion. Right? That is about psoas minor. Coming to the next muscle is iliacus muscle. It is a fan-shaped muscle and forms lateral component of the iliopsoas muscle. See, this is how it is fan-shaped. Okay, it is fan in the right iliac area, and all the way down it is reaching the lesser trochanter. You see, it is reaching the lesser trochanter. Right. It arises from the upper two-thirds of the floor of iliac fossa, inner lip of iliac crest, and upper surface of the lateral part of the neck. The fiber converges on and fuses with the lower part of the psoas. Okay, we already learned that lateral inserted on with the anterior surface of the lesser trochanter, an area 2.5 centimeters long below it. We'll see. See, okay, this is the origin, right? Along those lines, right? And this is where it is inserted, right? Section, lesser trochanter. Okay, origin and along with the psoas major, it causes flexion of the thigh and the lumbar part of the vertebral column. Right? That is the action. It is a flexor of the lower limb. Coming to the last muscle, quadratus lumborum. That is a quadrilateral muscle, right? That means it is like that, which fills the medial half of the gap between the 12th rib, iliac crest, and the tip of transverse pars of the lumbar vertebra. You see that? You see? So that is the quadratus lumborum muscle. It is quadrilateral in shape. Okay, this is the 12th rib, right? This is the iliac crest. So this is between 12th rib and iliac crest, and also the transverse process of lumbar vertebra. You see how it is attached to the transverse process of the lumbar vertebra, right? You can clearly see that, right? Okay. Okay. The quadratus lumbar muscle is enclosed between the anterior and middle layers of the thoracolumbar fascia. Okay. If you revise your old lesson of thoracolumbar fascia, you can clearly identify in which layer quadratus lumborum is present. Arises from posterior one-third of the inner lip of the iliac crest. So it is arises from iliac crest and iliolumbar ligament, lower 2-4 transverse parts of the lumbar vertebra. 2 to 4. Okay, lower 2 to 4 transverse processes of the lumbar vertebra. And insertion, the muscle runs upwards and medially passes anterior to the lateral arcuate ligament to be inserted into the medial part of the anterior surface of the 12th rib. That means, see, if you see the muscle, see, here it is where this is red, where it is arising from the iliac crest and lower 4 transverse process and inserting into the transverse process and also the 12th rib, right? Okay, that is the insertion point. See, 12th rib. So the muscle originated in the iliac crest and inserted onto the 12th rib. It is a lateral flexor of the lumbar vertebral column, right? It fixes the 12th rib during inspiration for effective contraction of the diaphragm. So it fixes the 12th rib during inspiration. Muscles of both sides acting together extend lumbar vertebral column. Okay, here you see, so you see, this is how quadratus lumborum is working. Okay, hide that. Okay, so lateral flexion of the vertebral column. You see how quadratus lumborum is working, right? Quadratus lumborum. Okay, lateral flexion of the lumbar vertebral column, right? But during inspiration, it fixes the 12th rib. Okay, the bone there moving along with the quadratus lumborum is 12th rib. The 12th rib is fixed during inspiration, right? Okay. Lateral flexor of the lumbar vertebral column, that is, but inspiration for effective contraction of the diaphragm. Okay, so this is quadratus lumborum. Again, these are all the muscles of the posterior abdominal wall. Psoas major, quadratus lumborum, right? Iliacus. Go through the table and go through the all the diagrams, right? We have some clinical point here, which is psoas muscle abscess. This is very important clinical aspect. That is why psoas sheath, to knowing about the psoas fascia and psoas sheath is very important. At first glance, it is difficult to appreciate why psoas muscle sheath is of greater importance than any other muscle sheath. The psoas muscle and its sheath arise not only from the lumbar vertebrae but also from the intervertebral discs between each vertebra. Right? We have already seen that. I ask you to remember that the psoas sheath, Psoas major also arises from the intervertebral disc and lumbar vertebrae, but also the psoas fascia, which forms the psoas sheath, arises from the intervertebral disc. That is very, very important because the disc origin is critical in importance. In certain types of infection, right, intervertebral disc is preferentially affected. For example, tuberculosis and salmonella discitis. Okay, so TB, okay, tuberculosis, okay, tuberculosis of the bone, or especially tuberculosis of spine, okay. So if the TB of spine is called as POTS disease, POTS disease, right? So if the spine is infected, okay, with the tuberculosis, and as the infection of the disc develops, the infection spreads anteriorly and anterolaterally. In the anterolateral position, the infection passes into the psoas muscle sheath. This is why it is very important, because the tubercular or whatever may be the infection, it passes if it affects the intervertebral disc, okay, from the disc, okay, the organism and all the infection particles spreads along with the psoas sheath. That means they are affecting the psoas muscle, okay, so that it become very tender and spreads within the muscle and sheath and may appear below the inguinal ligament as a mass. Okay, so it appears below the inguinal ligament as a mass, which is very tender and it is impossible. Okay, there is great difficulty in walking. It's a extremely painful condition. Okay, you have to drain the abscess. You see, this is the pathway of abscess, right? In the psoas sheath, it is coming and appearing as a bulge. Okay, in the groin. Okay, or in the femoral triangle. Okay, okay, in the femoral triangle, right? I'll show you CT. Okay, I'll show you the CT. Okay, see, this is, see, so the larger accumulation, okay, okay, that is the psoas abscess. Okay, uh, to your right, okay, to your right, that means left side of the patient, right, left of the vertebral body, right, there is a large accumulation. It is axial non-contrast. Okay, okay, so if you done the abdominal CT, it will appear like that. Okay, that is psoas abscess. Okay, okay, you see, you clearly see that is the psoas abscess. Right, if you scroll down, the different parts of, see, psoas abscess, right. So that is the topic today. Okay, muscles of the posterior abdominal wall. Go through the topic. Okay, tomorrow we will discuss about the great vessels of the posterior abdominal wall, especially the abdominal aorta. Okay, that is why I have divided the lesson, because we have to learn very deeply, right? Let me know